Muy buenos días a todos y a todas que nos asisten en ese momento. Vamos a
Good
dar inicio
morning to all of you. We are going to be starting our seminar for today on estimating of the canine and feline population in the Americas. I would like to thank for being with us today. We are streamlining this seminar will be recorded in Facebook, and also it will be made available with a recording in YouTube in PAHO YouTube channel in English, in Portuguese, and also in Spanish. Very well. Today, we are going to be discussing and learning more about the different experience of some countries in terms of the estimation or assessment and on canine and feline populations applied to the surveillance and control and prevention of zoonoses. These definitely are very important in our continent. Very swiftly, here we all have the agenda for today, our working agenda. We hope to have actually an interesting journey today, and we are holding fruitful discussions. We'll be able to learn, and we'll have important information about experiences by the countries. And I'm going to be requesting Dr. Kosigi from the Put-a-Mouth Pan American Health Center and PAHO WHO. Then he's going to give us his welcoming Put-a-Mouth Pan American Center. Thank you, Dr. Cotorino Cosibe has now the floor.
Okay.
Yes, Dr. Cosibe, we can hear you. Well, perfect. Welcome to all colleagues and friends. And we thank you for sharing this space with us on the seminar on the estimation on the canine and feline population. The objective of this seminar is prevention, control of those zoonotic diseases. Much of these examples derive from the need of exploring the different programs that have been established in the countries. I'm not going to say anything else. I just want to thank again all those who have joined us today for sharing their important experiences and to actively participating in the seminar. A word to Dr. Veronica Gutierrez from Mexico, to Professor Nestor Fraconi from Peru, Dr. Eduardo Jimenez from Nicaragua, Dr. Emilio Faro from Argentina, Dr. Camila Martinelli from Brazil. They also will be sharing their experiences with us. And we have high expectation from everybody's expectation in terms of the different comments that are to be made. Also, the result of this seminar will contribute to elaborating a document they're going to be sharing with all our colleagues in the region to aid this calculation estimation process. Also, PANAFTOSA will keep on providing technical cooperation to the countries and the programs that might need our collaboration, being zoonosis program, and also in terms of the different canine and feline population assessments. I would like to suggest you to take the experience with you, and this will be published in a scientific journal. This is fundamental in what today is being discussing with the concept of One Health, when we have animals like cats and dogs that are involved in the epidemiology of zoonotic diseases, the estimate of what is the population, which is fundamental also in terms of any type of assessment of programs. I would like to greet you once again, and I want to thank you. Thank you very much, Marco, and our colleagues who have joined us today. Thank you very much, Dr. Ottorini Cosibe, PANAFTOSA Director, for his welcoming words. I want to thank you for your suggestion in terms that we could have a communication on the advancements and the follow-up of the actions of the seminar. Just to state that you can send your questions, comments, suggestions to this email address, redipra@paho.org. And we know we are going to have questions in Facebook, in our streamline transmission, in the streaming transmission. And we are transmitting this, we are streaming also this video for the YouTube. Any suggestion, please, or question, send them to this address. Next, we are going to be going to the second point of the agenda. We're going to be having a roundtable discussion on the use of the estimation of canine and feline population in the control of zoonoses. Dr. Veronica Gutierrez will be supporting us in the roundtable, who is a subdirector of Zoonotic Diseases National Center for Preventing Programs and Disease Control from the Health Secretariat of the Government of Mexico. Dr. Veronica, I give you the floor if you like to make any comments, and then we are going to be starting a roundtable discussion. Thank you very much. Good morning, Inge. Good morning with all of you. I want to thank you, PANAFTOSA-PAHO, and those also Torino Cosibi, for inviting us to participate in also our program, especially. Also, we like to what Dr. Cosibi said. Also, it's important to learn actually data to design programs for zoonotic diseases, especially for dogs and cats. And also this allows us to better assess needs and the feasibility or the different actually results of the different activities. And we are here at your disposal to support a roundtable, which is the use of the estimation of canine and feline population, the zoonosis. Dr. Marco Vigilato will introduce the topic for the session. Thank you very much, Dr. Veronica. I want to thank you all. I'm going to be start very swiftly with a presentation. We're going to be showing you a couple of slides as an introduction to this topic with the estimation of the canine and feline population. In the first place, also an important point to ponder, what's the makeup of this population? We'll talk about the canine population. That is actually, we have more scientific evidence, but we can be dedicating also to feline population estimations. But we know already have several types, we can say, of dogs and situations. Actually, we have strict dogs. These are dogs, they are safe, they are in home or in an apartment, they have a proper veterinary attention, and is kind of a member of the family. We have to learn about this that is well cared for. We have also we have family dogs, those dogs that are not so much inside households or apartments, and have a certain and they have access and go to the street. And they are street dogs. They're not street dogs, but they have an owner. But the dog goes out and comes back to his house. Also, we do have community dogs that also are part of the stray or street dogs. There are dogs actually that are cared by the community. They give food, shelter, water, and but they live in the streets. They have a communication also with other dogs, family dogs. And finally, we still have yet another group that goes of actually street dogs and wild dogs. I worked actually in wildlife, in agriculture, those animals. We have many of these. There's a lot of literature on these animals that live in, let's say, in ancestral conditions coming from the wolves. Actually, these yet another condition, and the contact with these dogs, with the community dogs and family dogs, are, I would say, the almost actually highly unlikely to occur in the family dogs. Obviously, there's absolutely no contact between those types of dogs. Therefore, among different studies, we see here a compilation of on our perception of our experience when we see in the different countries. We have four types of dogs: the household, the family dogs, community dogs, and wild dogs that live in the wild. And we know those strict dogs that are family dogs, this percentage within a population or a city, that would be a 5 to 10%. Also, the wild dogs are less than 5% and all, but the majority of animals, be it over 80% of the dogs of the canine population in a certain population, are made up by family and community dogs. These are the dogs that are the object, as would say, the most important object of public health actions, prevention, massive vaccination is the actually leishmaniasis prevention and whatever. There is series of preventive measures that are being adopted to this population. And also these are the populations that are targeted because these actually dogs that live in a house and apartment. Actually, they actually are groomed. They are taken care of by a veterinarian. Also, they are also healthy, but the family and community dogs are less healthy. And these are the target of our analysis. Okay, please, we cannot blame the dogs. We are to blame in terms of the extreme unhealthy conditions they live in. We can see different examples. I always say that actually they're actually also there are no health conditions. There's no proper programs actually because you see this trash. And also it's no responsibility on public health. Also, there's a trash on the streets. Other sectors also should be involved when we talk about this topic to learn and preventing and to avoid these animals from proliferating, so to keep on living in our environment, wherever it might be, where you see a lot of trash around and garbage. Also here, I put four types of zoonoses, visceral leishmaniasis, rabies, and also other diseases could be added that can generate impact in canine populations, be it in human populations in terms of the diseases. In also in we have trichosis, for examples. Other zoonotic diseases are related to cats. There's spirosis also that could be added to this list that the relationship between animals and human beings. If we could adopt preventive actions also for this type of population with aggressions, I could say. Yes, yeah, another problem to be added in public health. Theoretically, the, the disease is not transmitted per se, but you have laceration, psychological, actually sufferings, perhaps an action in public health to prevent infections, as we see the hand down below. Actually, this person was actually has been bitten by a cat, and they cause bacterial infections. The process also we have microbial resistant. It's an issue that is serious. There's a series of reasons for to give an importance to be working with those topics and preventing this kind of situation. I'm not going to go into the detail because Dr. Nestor, Dr. Emilio, Eduardo will be delving with this topic. Everybody will talk about their video and experience. I would like to say that there are a lot of references from several years. So everything is included in this literature, and you find this important literature. Many of these articles are also in Spanish, but oftentimes they're not accessible to other areas. So I invite you to find this important information. There's a lot of information, there's a lot of experience in this articles that have been published. In now, today, we're going to be discussing with a few examples that can be the basis for your projects in the future. Well, we just have a compilation of the literature in Latin America. You have, you see, have the dog for 10 inhabitants doesn't exist anymore, especially in that continent. We have many more animals, and we have to be more responsible than before. Well, this is the end of my presentation. I want to thank you once again, Dr. Veronica, and I give you back the floor. Thank you. This was my presentation for now.
Thank you very much. It's very interesting to see this classification of the different dogs that we have in our countries. Okay, let's start with our round table for the estimation of canine population. And we will have to speak here now, Professor Dr. Nestor Falcon, who's a veterinarian, is also a professor and researcher in the University from Peru, Caetano Heredia, and the theme will the survey technique through stratification. I'll pass the floor to Mr. Nestor. Thank you very much. Good morning to everybody. It's a great pleasure to be here in this, in which I will bring the Peruvian experience in which we demonstrate not only the work that we have been doing as an institution, but also from different institutions, and I will show that in a moment. So the theme that I was invited to discuss was the technique of surveys through stratified housing. So in order to make an introduction, I would like to talk about the knowledge about the population of dogs and cats can actually give a basis from which you can implement and improve the planning of the health programs in terms of anti-rabies vaccines and the responsible guarding of these animals. And as a consequence, this would improve the assessment and the covering of the infected. So we have to analyze how the whole situation changed after implementing some different programs. Of course, the best thing that we could have would be a census, of course. There's no debate about that, but nevertheless, the conditions through which we can actually develop our countries, in some cases, this isn't allowed. Given that, what we should do is to try to look for some techniques to make an estimation of those canine populations, and I will mention some of those techniques. So the objective of those techniques is to quantify demographic indicators in order to be able to estimate cats and dogs populations, domestic cats and dogs populations in different houses and geopolitical regions. It can be a district, but that is according with the distribution in our country. So the information to be able to obtain would be the following: the proportion of houses that have cats and dogs, the average of domestic pets per house. So we need to sort of create an average. This is probably what really interests that the the amount of the people per cat or dog, the demographic features like age, gender, race, and reproductive conditions, the natality and the survival of the pets, and the health expectations, the life expectations. And we use all this to be able to recollect information. In order to mention a bit what we have been doing, and some colleagues have been doing that in the country, we defined, in order to be able to do this study, the place. Usually we worked with provinces, and usually through districts, also observational studies, descriptions, and so on and so forth. So the target population are the houses. So here I'm showing here a district in Lima where we have done a study, and I'm going to use that as an example to mention the different steps that were necessary for this study. So the first thing that we have to define are the size of the sampling. So as you can see here on the screen, we use the reference proportion here of 50% of houses that have dogs. With this formula, the sampling used to be from 385 to 685 surveys as a minimum. And we try to work as much as possible to have a constant result. So what we did is work with blocks. And each block, what we actually do is to collect the information. So for example, if the sampling is 664 homes, we will going to survey 10 homes per block, for example. We will have 67 blocks that will be chosen for the sampling, for example. This is an here, for example, we used the district of Lince. That was the last year. So in this district, for example, we have a subdivision of 5 sectors. And this is the amount of blocks of each one of the sectors on the right-hand side. And we have 241 blocks. So what do we do? What we need to do is to subdivide the blocks through 67, which we had defined before. We have to determine how many will be extracted of each one of those sectors. In order to do that, we're using the stratified sampling, and you can see the example here. So we see the total of blocks of one sector and the total within the total blocks of the population. We multiply it through the number of samples. We usually put one dot more in order to round it up. So what are we going to find here? We are the number of blocks that will be selected: 21 for number 1, 15 for 2, 13 for 3, 14 for 4, 6 for the 5th sector. Let's remember that we're going to multiply each one of those numbers of blocks through 10 in order to determine how many surveys will be done in each sector. And using this methodology, we will have 21, 15, we will multiply that, we will have 690 surveys. And this is more even than what we selected previously. And this is very good. Whenever it's over, shows it's okay. But when we have to select a block, or the 21 blocks here from this total of 73, what are we going to do? Is a systematic sampling, and we will divide 73 through 21, and we will have 3.5 as a result. And we also have to work between a number between 1 and 3.5, And we will use the example, we will select number 2, for example. So the first block that we're going to include in our survey will be the block number 2, and then we will sum the constant number of our sampling in order to try to visualize the methodology that we're using. For example, 2 plus 3.5, 5.5. So we will round it up, 6. So we will choose the block number 6. And here we will also use the decimals here. We'll get 9, 9 plus 3.5, and so on and so forth. So in that way, we will obtain a number of blocks that we're going to select in each sector. The same we will have to do with the different sectors. Very well. Once we defined which blocks are going to be selected, we know that in each one of the blocks, we will have to collect 10 surveys. So what we need to have to take into account is the following. The homes that are closed won't be taken into account, and you have to look for another home until you actually complete the number of surveys. If this isn't possible, if we cannot complete it in the same block, we can go to the next block. And it is important for us to be able to achieve those 10. If those blocks are not blocks, but sort of different buildings that go together, we have to analyze this whole group of buildings. And then we will choose, for example, 10 apartments ad hoc. And this will be enough to be able to complete the 10 surveys. So this is the methodology that we are using and that we would like to demonstrate. And in that way, we collected the information for our study. Of course, it can be very easy in an urban center, but sometimes we're in the periphery where the subdivision of the blocks is not quite clear. And what we will have will be sort of human settlements. In those cases, the human settlements, they can be much bigger in terms of size, but all of them have more or less the same features. So what we do is to be able to obtain some population groups. And in order to do that, we do a conglomerate sampling. We did that in Ventanilla, and we got 10 from approximately 40 settlements that we incorporated to the study. And in order to select the amount of homes that we would obtain in each population group, we use the same methodology. As we've seen before, a systematic sampling taking into account only the homes. And this is the example. And for this study, we calculated this final number, 666 homes. So once we have this information, we take that to the database, we make the corresponding analysis, and we try to estimate the population of domestic dogs and cats. So in this case, we are going to use an example for dogs, and we will have this ratio per person. We will have the total inhabitants obtained in the survey and the total dogs obtained in the survey. And how can we use this in the total population? We will work with the total population in the studied zone, and we'll subdivide it through this ratio that we obtained in the study. And we will get approximately a number of the population of the dogs. Very well. On this sampling, we managed to get many different results in Magdalena del Mar. With this work done in the University of Sur, we got this ratio of 5.88. 5.6, La Esperanza Trujillo. Here, 5.52, Ventanilla 3.98, and Miraflores, that's ours. Also done by the university, 4.98, and San Borja 5, in Chorrillo, 4.85. Here, Pilcomarca 4. The university did this study as well. In Arequipe, 4.7, and here 4.4, the University of Santa Maria de los Flores. So we have this ratio, and here the geographical place, and then we will round it up. And now we have much more dogs nowadays. So after gathering the different geographical places that have social, economical, similar conditions, they are very similar. Here, Miraflores and San Borja, Magdalena and Bellavista, both in Arequipa, all of them have very similar results. So we have less studies with cats, but we will see an example further on, and in more vulnerable zones, you have a different result from the richer zones. Here, I would like to demonstrate that based on the results of the study, we managed some indicators. And here, for example, I'm using some indicators of dogs and cats for San Borja, where this is higher classes, and Ventanilla, which is a bit lower. We have here, in the case of dogs, it's bigger in Ventallina, and in the case of cats as well, the relationship between people and animals. Here you can see the numbers that you have more pets in a poorer area, and the life expectations. Here we have see the numbers and the survival of the dogs, the recently born dogs and cats. You can see here in the last line, and here are some comparisons. And here we did different workshops to estimate the canine population in areas where there were rabies risks. Here you can see, for example, the numbers on the screen. And here in this area, we have rabies. They used to have a rabies. And now that there was a vaccination campaign, we have the results of the studies in each of the regions. And after the workshops, we haven't had rabies cases in Arequipa. We found 3.39 and 1.28. And this is extremely important because when they were doing the study, this demonstrated that the coverage that used to exist in these of 1 to 10 was far from ideal. This is what we're doing in the case of stratified samplings, but I would like to show this experience, which is the studies through the different educational institutions. I mean, all the sampling of this institution. When we really need information urgently, we thought about that the educational institutions could be an alternative, and we would just deliver the different surveys and control books. This would be sent to the different homes, and this would be sent back through the same way, in the same way. And in order to select the different educational institutions and to select the participants, what we used to do was to create a segmentation district in different zones, and in each one of this zone in this module, you would have the different biggest educational institutions as public or private. And so we knew that the people that were around, the families around, probably the majority would send the children to these institutions, but of course they could be sent from other places as well. And that's why we had to use some filters in the survey in order for the family only to answer one of the questionnaires and also to be able to discriminate the district of origin. So if we were, for example, in San Martin de Porra, we would, the person would need to mark it, and also the organization, this geographic subdivision. Otherwise, they could mark their district and specify it. In this way, we could discriminate and use the information. Through these different studies, we managed to have the following result. In San Martin de Porros, for example, we had this ratio of 7 people for 1 dog, here 5.74, 3.44. So those results here in blue, they belong to a project of the identification of the needs of communication on the rabies risks, the behavior, and also the risk areas. So we included the question. This was also a survey that was sent. And here we obtained the following results.
When we work also with Juliaca, we see the 6.2 per dog. In Puno, 7.04, Juliaca, 5.29 per dog. In Madre Dios, 4.12 per dog. So this has been important for us in our assessments because after the question was the accuracy of the results of this sampling with the school sampling actually compared to stratified household sampling, we had the opportunity to find these different results. And we find this by chance. Then that same year, we had workshops and we had the sampling by school, and we have the ratio 4.3 and 4.2 for 1,904 surveys. In this school, side is the surveys per households. And in November, we have 7.05 people per dog. And also in the in-school sampling, in 470 surveys, we have 7.04 as a final number. Out of the close numbers, that I suggest if you have an extreme need of learning data of this ratio, the amount of domestic dogs to be found in the household, this might be a good alternative. And with this, I close my presentation. I can show you now the public health and veterinary epidemiology laboratory members, but they have students also. They have supported us. These were essential in our sampling methodology. Thank you very much for your attention. And and if there are any questions, I will respond to them very gladly. Thank you very much, Doctor, for your excellent presentation. And well, of course, definitely we're going to have a lot of questions for you, no doubt. And I want to thank you also for being sharp on time. Now we are going to go to Dr. Eduardo Jimenez. Eduardo Jimenez works in the health ministry in Nicaragua. He is responsible for the rabies program. Mr. Jimenez will talk to us about his experience in the application of estimating methodology at national level. Dr. Jimenez, good morning. Thank you for joining us today. You have the floor. Thank you very much. You have 20 minutes for your presentation, sir. Good morning. Good morning. Good morning. I will be talking to you this morning about the experience in Nicaragua in the assessment of the canine population. I'm going to start off by stating that by year 1997, we had the first estimation survey of canine population in 5 areas in the country. And we saw the ratio of 8 inhabitants per dog. And also we have different cases of canine rabies, and this was according to the size of the population. And we see the CELAIs actually made this, use this methodology. And we have actually have 12 households per block per neighborhood. And these blocks were chosen randomly. And we also made a survey of following actual hands of the clock. We tabulated all the information in excess and divided the amount of dogs that have been found according to the number of people. And we have done this throughout the whole country with a population of 4,100,000 inhabitants. We had a canine population of over 500,000 dogs. As you can see, preventive actions. We had vaccination that started in 1996 until 2016. Also, that a lot of dogs were remained without vaccination. As we can see in this year, when we talk about canine vaccination campaigns by the year 2016, for 26 from June the 13th to 16, we have an international surveillance workshop. The objective were to strengthen the node in terms of planning and implementation of the vaccination campaigns against rabies in dog. We want to have the transmission of logion, the updated methodology so as to estimate the canine population. We want to strengthen the key element of surveillance of rabies to be able to have the elimination of rabies. And also rabies, actual in wild rabies, herbivorous rabies, and the control of the population, also in bats. With the activity, we talk to the health ministry officials, and we see the idea of holding actually make the also this survey to not to estimate the kind of population in population. In April 23rd to 24th, 2017, we have a technical meeting to have the survey for calculating the canine population in Nicaragua. The idea is that we want to engage actually the epidemiologist population and also the nurses, also this community and personnel that actually are dedicated to community health services and also the Pacific coast and the Atlantic coast is also integrated this whole population. But also there are different languages according to the actually to the cultures in actually between the Pacific and Atlantic population. And also this agenda in this capacity building, we make a proposal for the estimation of the canine population through household surveys. We had the validation actually of the surveys to the calculation of our canine population. We had a distribution of the teams of surveyors in the field, and we prepared the surveyors team to do the surveys in the field. And this was our proposal in the country. We have field work. We have a team of observers also assigned to make an assessment of the field activities. And also we developed an important database. We have descriptive statistics in Excel sheet. We have a descriptive statistic analysis of the results of the survey, and logistic requirements for the elimination of urban rabies in Nicaragua, and communication and health. In the year 2017, with the support of PAHO, PANAFTOSA, and the health minister in Nicaragua, also we have the national surveys also to estimate the canine population we did for the June 1st to 15 of the year 2017. As was said also, Dr. Enito Tongo, oh, he has been following us in this whole process, supporting the national survey for the estimation of the population and the methodology, the same methodology that was used in the country in order to do a follow-up to the national survey as a whole. This survey included 100. Also, we had the definition of actually of the different types of civilized areas in the country, the population, and also the amount of program surveys and the amount of surveys that made and the total of surveys realized, as you see in each one of the columns for the rabies program. And we were fully convinced also this was a big challenge for the health ministry to be able to have this national survey implemented, but because of the time frame that has been stipulated, we got we got to the assessment or the estimation actually of the ratio actually between people or person and dogs. We have the different indicators that were reached after analyzing all these service or responsibles, and we have final result of 3.4 dogs estimated at national level. We have to stress that this survey also it had been able without the full participation by the health personnel in the country, especially with the sanitary, the public health inspectors are in charge of developing this program actually in each one of our 19 state environmental health responsible in 19 cities also were at the advanced guard in implementing this survey, obtaining these important results thanks to all these participants. As the final results of the survey, first we have an increase of the estimated canine population. We were calculating an indicator actually of 8 in the population. According to the survey in 2017, we see a doubling of this population. And we have an increase of this inputs, and we see that this application, the amount of dogs to be vaccinated, we see the increase of inputs in terms of vaccination cards, syringes, and also, and we need actually a higher budget in order to cover this population. We had to purchase more vaccines, as we say, the vaccination actually cards, as we know, because we needed more. We needed over 1.5 million actually vaccines and syringes and cards and higher budget in order to mobilize human resources to be able to have these vaccination days. Yet, by the year 2017, obviously, we had in perspective there will be increase in the canine population in the country, but we have earmarked that we consider that the estimated population in 2016 that was a little lower number actually. So also we compare then actually to the year after, by the year 2017, we had calculated and at this year we vaccinated 743,000 dogs. For the year 2017, we had programmed the acquisition of over 1.8 million inputs or vaccination. When we talk about that, actually, we see that there is a doubling of the canine population in the survey. There's how we were able, for the year 2017, with the survey, also, this gave us opportunity of learning see the sexes, they were female or male, and also to be able to make a project to the future in terms of the new strategies. This population actually was not vaccinated should be covered in the increase that we saw in terms of the population in the coming 5 years. And also we are able to obtain the age of the dogs, and you find the stratification, stratified data of the different age groups of dogs that were found in throughout the canine population survey. We see 2017 to 2021, will see the actually yearly increase of the amount of vaccinated dogs. I said by the year 2017, 790,000, in excess of 790,000 dogs were vaccination, and also we were able to vaccinate in excess of 740,000, and some dogs were left without vaccination. When we talk about 8-to-1 ratio, by the year 2017, then when we also buy 1.3 million vaccines by 930,000 dogs were vaccinated, but there was an excess actually was not vaccinated. And also we see finally there were not 100% of inputs necessary in order to provide each one of the selected vaccinations, at that a natural average we will be round to 4, adjust the 1.3 doses of vaccines to care for the population, and the ratio was 4. And this indicator at national level for the year 2018 is important to state that early on, also 2019, they had to use these results obtained during the year 2015 data. This is how finally, actually, we make a projection of vaccinated or to an excess of 1.6 million dogs. Out of it, this year, 1.2 million were vaccinated, and all in excess of 400,000 were left unvaccinated. For 2000, we have also to see that this year, 2018, it was a difficult year for the vaccination day. It's in 2018 because the social political situation that we have in the country, many areas of the country rejected, they refused to get vaccinated. So this year, problems because of the situation. We are lower in coverage because of the situation we had in the country that year. By the year 2019, here, we saw still the consequences of the social political situation of the year 2018. Still, we make it a big effort to improve the vaccination coverage in the canine population. We want to vaccinate in excess of 1.7 million dogs, and we're vaccinating over in excess of 1.1, and also 4,000 were unvaccinated. For the year 2020, already because of the pandemic, we wanted to vaccinate 1.7 million dogs, and we vaccinated also 1.5, more or less. There was an increase as we saw, but still we have 344,000 dogs without vaccination. For this year, we have programmed 1.7 million dogs to be vaccinated, over 1 million. Still having 240,000 dogs were unvaccinated. In the next graph, we are going to be observing. Here we'll see the coverages in the last 5 years. In 2017, we reached 57% vaccination rate at national level. As you can see, that almost all areas that were low in coverage because they lacked the inputs, and the survey had been just completed, and we realized that the canine population actually in our country was underestimated. By the year 2018, we increased the numbers. We reached 72%. Only one of the 19 stelis actually weren't able to reach coverage, but and one 89%, and the rest were left below 75%. Only 3 actually reached 90% by 2019. Will have better coverages over 90%, and also from 80 and 90%, some areas were achieved, and many sites already have less than 80% rate. For the year 2020 already, we see there are sites of areas that reach 100% rate, and others were left between 80 and 90, and 5 sites of areas actually were left below the planned coverage. For 2021 already, we have a well-defined program on the CLAs. They reached over 90% rate coverage. Only 3 TLIs had from 80 and 90% coverage, and 4 TLIs were under 80% rate. And we have to say here that in the case of CELAI Madrid, let's say every year they have low coverage rates because there was complication when making surveys, and we have, after completing the vaccination days, we made actually other surveys to check if there's a problem, and we found there are no more dogs unvaccinated anymore. It's true, we found dogs that were not vaccinated, but not the big amounts, I would say. And those data were revised, and where they had problems when making the survey, implementing the survey. Also, we will take a closer look to the table and the different results of the CLI. The highest indicator has 1.9 people per dog.
So it's even over the national average of 3.86. But nevertheless, we have the other extreme in which we have the lowest numbers here in Bilwi, here, for example. So in this, what we can actually study, we actually recommended the use of the national average. And in the for example, this year they did a census, and the population agrees with those percentages that were achieved. And the problem that they happened during the survey, and we are trying in the next year to make a better follow-up of the CLA in order to improve the vaccination of anti-rabies. That's all what I had to share in terms of the estimation of those populations. Thank you very much indeed. Thank you very much, Professor Eduardo Jimenez, for sharing this presentation, and obviously for adjusting to the time frame. And continuing with the roundtable and with the next panelist, I will introduce Dr. Emilio Faro, and he's a veterinarian from the coordination of the Health Ministry of Argentina, and he works with animal physiology in the Veterinarian University, Buenos Aires. Professor Dr. Emilio Faro, please talk about your estimation of canine populations in Argentina. Thank you very much indeed. Can you see my presentation well on the screen? Yes, excellent. Okay, very well. First of all, I would like to thank you, of course, for the invitation to share that we had here in Argentina. And what I'm going to show you is how we actually do the comparison of two methodologies through those pilot tests in the province of Buenos Aires, which is a Saladillo municipality. We had a collaboration of the province of Buenos Aires and the urban zoonosis department, and also from the municipality itself, Saladillo, which facilitated part of the resources for this work. Sorry, it's not a presentation mode. Yeah. Can you see here? No, Emilio, we can only see the PowerPoint. I don't see it on presentation mode. Please change that. Now here I can see the presentation mode. Thank you very much. You can see that now when I change the slide. Okay, perfectly well. As I was mentioning, and as Marco also mentioned, the need of generating those protocols has to do basically to be able to obtain information not only from the domestic animals, but also from those family dogs, the strict family dogs, and also the street dogs that can be incorporated in this study and that have access to the streets, be it because they live on the streets or because they have a family and a home that allow them to go out in order to come back later on. And with that, the idea was to gather the information to planify and implement different activities that have to do with how not only for animals, but for human beings. Vaccine, anti-rabies vaccination campaigns, deprioritizations, and one thing that is very important, it's a fragile aspect, and it is important mainly of the prevalence and incidence of different zoonotic diseases, like rabies, hydatidosis, and so on. In order to be able to obtain the information of the population, we're going to make an ad hoc selection, a sampling, that will allow us to conclude through a probabilistic sampling in different phases, be it for domestic animals or street animals, based on the population. So we worked with two different methodologies simultaneously, with the urban zoonosis of Buenos Aires and the health ministry, in order to be able to compare them, given that both had different resources, and in order to be able to differentiate whether there were very different results within this methodology. In order to do that, there was a selection of the municipalities and in the province of Buenos Aires, and within that, census fraction. And in this case, we use the census fraction number 1 here on the map in lila, and this was used for the methodology of urban zoonosis. And of course, we needed sanitary agents that were called according with their resident zones. Also, the local organization of the workers that work with zoonosis, and the participation of the population, and we need resources for the data. In the case of the province of Buenos Aires, we use the spreadsheets, but in the case of the methodologies, we used an app or in our cell phone with a questionnaire that we used to include the data for a cloud. And from then, we would then work with the digitalized data without having to download them first or upload them first. Therefore, in this methodology, we call them avenues because we generated and we built different conglomerates through the main roads and avenues, not only for the sampling of the different homes through the surveys or through the street dogs samplings, be it through the observation, and the conglomerates were the avenues. And a second phase, those conglomerates or those clusters that were built through the different avenues would be sampled simultaneously, not only for the surveys, but also for the comments and observations on the street animals. And I'm going to show you a map later on, but this is just for you to have an idea about the different avenues that have been selected. And the sampling were of 33% of the blocks, and this was done through selecting 1 block and 2 not on the map. And within those blocks, we selected 50% of the homes for the survey. And for the street animals, these avenues were analyzed, and we if we actually found out that those avenues had, for example, more than 30 blocks, we would create different circuits of 10 blocks, but if they were smaller, which is what happened normally, most of them had less than 10 blocks, we would show them completely, would do the sample on the whole of the avenue. Here we have the map, we have the blue lines. Those are the limits of this political division that is used in our country for the different census. In another map, I can show that better. For example, in this avenue here in red, we would go from here until here in order to observe the dogs that were on the street. And meanwhile, we were making this observation, we would separate both sides of the avenue to make the census of the homes. Those are the avenues that were selected in both census, in both. So this information was given by the local municipality, and they informed the avenues that were more relevant and the streets that were more relevant for our study. On the other hand, the methodology that was used by the urban zoonoses of the province of Buenos Aires, and that was done through a to choose the different blocks, that is called here LIRA. This software and this type of sampling is used in order to work with different diseases. So what we did is, through the system and incorporating that in the software with the amount of blocks that have to be numbered, you can choose a certain number of blocks for our surveys. So in this case, we selected fraction number 1. Here we had 17 radios, 313 blocks, 6,403 homes, from which we selected 23 blocks, and we surveyed 50% of the homes of these selected blocks. So, in order to understand furthermore the map and the methodology of the urban zoonosis, and in order to create a comparison, I can show here in green, we have the fractions. This is the political division that I was mentioning before. And here in red, we had the radios, and within each radio, we have many different blocks, and in each of them, we have different amounts of homes that will be surveyed. So once we chose them through the software, if we selected it in this example, we have a 20% of homes. But just for you to have an idea, we selected the first home. And in that sense, clockwise, we used to then sort of analyze, we would survey each of them if, for example, the home was closed or they refused to participate. We used to choose the next one until we concluded the necessary number of homes. And if in this home, for example, we have an ensemble of different departments, we used to include them all. For the street animals, with this methodology, what we used to do was to stay in between the different blocks and observe just in the 4 directions what happened in these 4 streets with the street animals. After using those 2 methodologies, we were able to compare results. I'm going to show some results of the province of Buenos Aires, and afterwards I will show you some results comparing it with the methodologies of the urban zoonosis. Here you can observe some interesting results. We have the indicators of dogs and cats. And here, what really drew our attention, and we have seen that in different presentations, was the number of dogs per human being. And what we noticed also, the amount of street dogs per block, and the estimation that were done for a total of every place between here we have 13,627 dogs, and here the estimation of the amount of the fraction number 1, where we have 2,790, and we were doing that per blocks. And why I'm talking about dogs, that even though the province of Buenos Aires did a greater survey, we tried to shorten it a bit because we were really interested in comparing the methodology, and that's where we only worked with dogs. Another important data was the estimation of the free animals on the streets, here 449. Other results had to do basically with the species and gender and age range, and other important results were the percentage of vaccinated dogs here, more than 1 year old, and so on, with less than 1 year, a low percentage.
As we saw also canines, also in terms of rate of actually of canine we're vaccinated, also anti-rabies, and the felines that are vaccinated, the other actually results. In terms of methodology that were used, we can see finally that there are similar results to be found. It's something we had already foreseen. And also we see the relationship or the ratio between inhabitants and canines also is 2.4% as the data have been found. Both for the average of canines per household 1.2, and the average per household, as we saw also here in the average of also of canines per household terms, zoonoses in Buenos Aires 1.3, and total of canines according to methodology we have 7,651 animals, and a total population in Buenos Aires also to compare data we found 8,388 estimated dog with either very small difference of around 600 animals, all within the range of a confidence interval of 5% interval confidence interval. It provides us with data that the results are reliable enough, and we can also trust the fidelity of this information. In terms of street dogs or stray dog, also we saw, according to your methodology, a total of canine population of 118 in the streets, and this methodology in zoonosis in Buenos Aires see 433, where small difference to be found in terms the actually confidence interval rate. In concluding, we can say both methodologies provide with similar results, and the use of one or the other method can be adapted according to local resources, to IT, human resources, mobility, to use the IFA method need previous planning, and then the other methodologies, but also perhaps it could need actually to survey many blocks. And the other method we could use actually lesser blocks. What we can say also, to obtain estimated data is the best option to be able to have the reality of this animal population. The census are almost utopical because this canine and feline population extremely dynamic in numbers. We have difficulties to be able to reach actually true numbers because of dynamism of the population. I want to thank you for your attention. I would like to thank Dr. Castillo from the Zoonosis Coordination Center, actually his urban zoonoses team, and also I want to thank them all that helped us in being able to make this comparison between both methodologies. I'm at your disposal, of course, to respond to any questions you might have in terms of holding sampling or the use of sampling methodologies. Thank you very much. Thank you very much for your excellent presentation. Actually, very interesting to learn from you. Different methodologies can be implemented in the survey that are very positive. I don't want to take more time. I would like to leave more time for the Q&A session. We have translation, so
I
you
would
can send
like
your questions
to
in English, Spanish,
present
or
Dr.
Portuguese.
Camila
Now I'm going
Marinelli.
to
She
introduce
is a
Camila Marinelli
veterinary
and doctor. She's a
and from the
professor
university,
of
the
the
State
State
University of
University of
Ponta
Ponta Grossa.
Grossa in
She
Brazil,
also
Paraná. She
she's a
also is a
consultant
consultant in
in the statistical
statistical
analysis
analysis of
in
scientific
scientific
research,
surveys,
and also
and she
gives
is a professor of
many
different courses
classes at a
in
AACT consultancy, a
different
research
institutions. Professor Camila,
company. So Professor
thank you for
Camila,
joining us this
welcome
morning,
to
and
our
the floor
seminar, and we
is
pass you the floor.
yours
Thank you
as
very
of now.
much.
Good morning.
Thank you very much for the invite. It's a great satisfaction to be here with you today. I will share my screen. If you could please let me know when you can see my screen. Yes, I see your PowerPoint presentation. There you go. So I prepared a presentation which is complementary to what the colleagues have been saying, and it's interesting to get acquainted with the experiences on and the approaches. So I will first give a brief introduction where I will describe the different experiences we have been seeing through time concerning this theme. And then I will show you 3 experiences that I have the opportunity of participating in. These 3 experiences have differences, not only practically speaking, but also statistically speaking, and all of them gave very interesting results. And so I hope to be able to further contribute to the discussion with these different approaches. I'd also like to tell you that the 3 experiences have all become scientific articles, so the references are below. And if ever anyone wishes to get a deeper idea of the situation of the study, they can therefore go after these references, which are all detailed in the publications. Thank you. So we have already been speaking since the beginning of the event of the possibilities and the experiences as societies with canine and feline populations, and the relationship between humankind and the canine population. We all know that there are certain limitations making estimates of human populations, and depending on the region, depending on the country, and depending on how that very population and how this population relates with the animals, all this changes the scenario completely. And so we have the populational estimates, which are mixtures of concepts in ecology, statistics, and mathematical modeling. And all of these combined have helped us to estimate these populations throughout time. In Brazil, I selected some experiences in the state of São Paulo from a few years ago, where they had used different methodologies, interviews using sampling, without sampling, convenience sampling, as well on sampling based on proportions, based on the calculation of the size of a sample, and sampling with more complexity involved, stratified, for example, and the different experiences only reinforced this relationship between the equation humans and dogs in order for us to better be able to understand the relationship between these two. And so there is a very interesting study which speaks about international experiences. And the purpose of the study is to discuss used by scientists. And in his conclusions, he speaks about sampling per convenience, which not necessarily went through a statistical procedure and a random selection. There's also random selection based on a database, on an original database, which did not have the purpose of being used for this study, and also questionnaires which are applied by pharmaceutical companies and clients. And there are very interesting international experiences in this line. And there are also door-to-door surveys done during census. And so we also have some of these experiences, and it's not easy. There is a lot of questions which arise, but there are, yes, international experiences in more isolated and regions, and there are also telephone experiences. So thanks to phone calls of a group, a sample of people who are registered to a database group. So sometimes we have some international experiences using the telephone interview. And when this work concludes, they claim that the most adequate methodologies are the ones, for example, the door-to-door ones, where all the present individuals, we have to do it practically, we have to go to door-to-door, and also probabilistic sampling, either a random sampling and complex sampling with 2 stages. And what they have in common is an estimate of the error and the precision of each one of them. So independent of the method used and the practical possibility of the method and the statistical possibilities of the method, all of them have to have some type of an evaluation with an error and the evaluation of the precision of this estimate, so that we can manage to get better acquainted in a more clear manner and a more precise manner what is the real scenario, even if there is a very low precision rate. And sometimes there are intervals, trustability intervals, and sometimes it is limited. And so it's interesting to have these international references. And of the error, despite the proposal used, despite the methodology. The first experiences that I'd like to bring to you is the experience in Brazil, in the region of Curitiba in the state of Paraná, specifically in the municipality of Pinhais. And during this research, they had about 110,000 inhabitants, just for you to have an idea of the size of this municipality. And this experience managed to use the structure of the municipality in order to control other diseases such as dengue, and do not have necessarily a direct relationship with this. And so it is a very well structured program in the municipality. There are many actions in place, and one of them is geographical recognition, which is the opportunity of having the agents which control epidemics. They go around the whole municipality in order to evaluate the strategical points of dengue control. And so they have a purpose within the program, and in order to evaluate the risk of dengue or not. And so the number of felines and canines in the municipality. And so looking at all the possibilities and the variables which are interesting for us about the dynamics of these animals, and since it was an initiative to take advantage of a terrain study which was already going to take place, we included only these 3 questions in our research. So this is a table that we filled out during our terrain study, where we would fill out the data of each household. And so how many dogs in the region, in that household, how many people, what was the income of that household, and so on. And also information about dengue. And so what did we manage to see? We managed to visit 13,585 households. In the municipality, they had an estimate of 30,600 households. And so in all these households, they encompassed all the regions. And despite that there was a very big gap with regards to the community, it was a very big sample when considering the size of the municipality. So this gave a certain robustness to the study. And so we were speaking out about 48,355 inhabitants, 110,000 dogs were sampled, 16,000 dogs were sampled in a total of 36,000. And so there was a ratio of 1 dog per 3 inhabitants, 3 people per dog, sorry. And so due to this sampling, it was needed that we do a different calculation. So there was an inflation of households with 0 dogs and 0 cats. And so for the estimate method could not be, for example, here we have the neighborhoods of the municipality and all the countings and the sizes of the samples. And so there was a super inflation here on the 0. And so we had to do a statistical implementation in order to apply the equation to the population of cats, and also the possibility of getting better acquainted with the population of felines. The second experience also happens in the region of Curitiba in Brazil, another municipality called São José dos Pinhais. It's a bigger municipality. They had about 300,000 inhabitants. And it's different than from the other municipality because it's a very big municipality. And so there's a very big area divided in urban and rural areas with a very big territory to get acquainted with. And so the townhouse of that, the local government already had a study going on in a neighborhood called. So the estimate was done in this very neighborhood. So in this situation, there had a simple random sample, 95% trustability and 5% precision. And it is a sampling which considers the universe and a random sample to be investigated.
So we were able to interview other people and ask different questions, okay? And so we had characteristics, okay, if the dogs had been nurtured, or not only characteristics of the people in that household, of the animals as well, okay? So demographics of the animal, sex, age, reproductive status, vaccination status, and other data that could assist us so that we could have this populational handling, okay, program. In this case, okay, the practical application was a partnership between the university and the municipality. And so the households that were selected, they were interviewed. The people there were interviewed. We went there to that neighborhood and we did a random distribution of the families and households that needed to be interviewed. And here we had the questionnaires being used. So as a result, 73.1% of the households had a dog or a cat. The relationship between dogs and humans was 1 per 2.7 cats, cats and humans, 1 per 16.8. Less precise when we're talking about felines, okay? 88.8% of the dogs had not been nurtured. 25.8% they had some access to the street, so they were not totally restricted to the households. Okay, they had their owners. 67.02% of the cats had not been nurtured, and 44.6% of the cats had access to the streets, okay? Okay, so as in this work here, we had the possibility to have the age of the dogs. We were able to create a chart that is well known in the human sector, which is the age pyramid, so that we could understand the dynamic of these populations better, and knowing the universe, how they were distributed, their ages, the males, the females. So I would like to highlight that they are young animals in this place, okay, and mainly the females, okay. They represent a higher proportion and they are younger. And so the age pyramid of the cats, they were even younger, okay. And so between 0, okay, between less than 1 year of age, okay, and we had a younger population here. So the third experiment was an experiment that also took place in the state of Paraná, but remember that Curitiba is the capital of the state. So it was not in the capital, it was in the countryside. The name of the municipality is São Mateus do Sul. At that moment, they had approximately 45,000 inhabitants, okay? It is a municipality that is mostly rural. And so we implemented a sampling strategy, and it was a little more complex than the other two. We used the sampling method in 2 stages. So we considered the total, okay, the universe. We carried out a procedure with the census sectors to see how many census sectors I needed and which sectors needed to be shown within the urban area and the rural area separately. We developed a specific questionnaire for this situation, and the methodology was developed by the University of São Paulo in Brazil. It's a methodology that is available for free, okay, and you can have access to this. And so this was the municipality. Please note that the red area is the urban area, and in blue we had the rural area. So they had different characteristics and different complexities, and we took all of this into consideration when creating our samples. So here are the census sectors, okay, that we used. So these are the census sectors of this municipality, and in each one of them, we had an estimate of the number of households in each one, and then we carried out a procedure that considered drawing of that census sector that was going to be investigated, and inside the sector, how many households should be interviewed and which ones. Okay, so we had a draw of the number or of the households, and by using geoprocessing tools, we located all of these households. Okay, and we made this available to those that were in the field. Okay, so in this field here, from a practical perspective, it was a partnership with the university, but agents from the municipality itself, they carried out the survey. And so they made available for the in-field agents to do this. So as the results of these experiments, we had 6,542 dogs that were estimated. Okay, that represented an IC of 95%, confidence interval of 95%. Okay, the average age was 4.8 years of age. 67% were not nurtured, 57% had been adopted, 15% had been purchased, 20% had access to the streets. 1,693 cats with a confidence interval of 95%, an average age of 2.9 years. 88% had not been nurtured, or they did not know the status, the reproductive status of that animal. 15% had been adopted, and 91% street. And here we also had we could do the age pyramid, and we also included the information about if they had been nurtured or not. And so there is a high volume of animals that had not been nurtured in yellow, okay? So they had not been sterilized in yellow. And it was a young population, and most of the animals, females and males, with ages up until 4 or 3 years of age. And here we have the age pyramid of the cats, okay? And we were analyzing which ones had been nurtured or sterilized. And the last one of this experiment was the distribution on the map. So we were able to carry out the ratio, the proportion. We considered the different areas of the municipality, and we were able to estimate these sectors, these census sectors. And we could clearly see the heterogeneous aspects and the differences. As final remarks, I would like to explain the following to you. From the estimates and what we know, we have what is ideal and what is possible. So the best combination of within these experiments and what we find in the literature is the combination of the two worlds. So if you don't have a ready, fit-all methodology, for instance, and that is going to fit of your reality, but you have to understand the context, and on top of that, you're going to analyze the statistics, you're going to analyze the more technical aspects, so that the two things together, they can produce a good estimate. So thank you so much for this opportunity. Thank you so much for your attention. Here is my contact information, my phone number, and my email address. You can also find us on social media and on our website, and I'm totally at your disposal in case you have any questions or doubts. Okay, thank you. Dr.
Dr.
Camila.
Camila, thank you so very much, madam, for your expose. Actually, you provided us with important examples of what can be done. We are going to start now with a Q&A session. Yet, I would like Dr. Veronica Gutierrez from the Mexican Secretariat could provide us with her remarks to comment on an example from Mexico. Dr. Veronica first, before asking questions. Thank you, doctor. Yes, Well, very interesting, all the different presentations made. And I just would like to state that in Mexico, we had a very important experience in the work that we have been doing for dog anti-rabies vaccination campaign. Also, when we have, let's say, a case of dog rabies or cat rabies, also we have an implement, we have a methodology, we have a survey, and we include several variables, as some panelists already brought in their presentations. Also variables, actually, there are pets or stray dogs or stray cats or pets, be it. And we made actually as surveys, and had been very useful to us modify our indicators in terms of human dog or cat ratio, and also the amount of pets per households. And we are able also to validate and change some strategies in age groups. For example, in Mexico, we vaccinate starting from the first month of age, and this has had a very important impact. We have limited the presence of rabies cases in these animals. And I asked to give you for the floor, so that I'd like to tell you they have several examples in the different countries with but we have been doing, and what the experiences have been revisited from other countries also actually trend our working framework in our different countries. And it's good to be able to have real and reliable data. This was said before, because these animals species are have very dynamic numbers, but we keep on working steadily in Mexico in order to strengthen and better know the real numbers and the variables that influence on the final numbers in terms of our cat and dog population. Thank you. Thank you very much, Dr. Veronica. Well, please, panelists, if you can open your cameras, now going to be starting a round actually of comments, exchange of ideas, questions to be asked. First, I would like to congratulate our panelists, Dr. Nelson, Dr. Emilio, Dr. Camila, of course, for the excellent presentations that have been made this morning. We have actually bountiful comments here in the chat box, and we had received a lot of comments also in Facebook. We are also live streaming in our YouTube and Facebook channels, and questions have been sent through the email address that we have shared before with you, and also through comments that you would like to forward to us. I saw in this chat, Veronica, lots of people praised. We have some questions in terms of the availability of these presentations, so that I could recall you. This will all be prepared into a document as an output of the seminar, and this document will be shared with everybody. Those who have not actually joined this link in YouTube, no, I'm sorry, in Facebook and chat in here, in Zoom chat, please put your names so that you can receive this information later on. We are going to be consolidate the 4 presentations. In other words, the bibliographic references of this whole presentations that were made, or even field work also will add actually the whole information in one document. It will be circulated to all of you. And also this document will include a summary and some different methodologies that we consider as that could be used as basis for you in your municipalities, might also use them also besides the experience that they have already shown here by our colleagues. I don't know, Dr. Emilio was able to open his camera. Please open actually Dr. Emilio's camera, the technicians, please. Don't worry, we have people actually they can do it for you. The first question that I can see that I would like Camila to respond to, and Nestor perhaps also, who are professors here, that could better respond to this question. This is an interesting question, I might say, asking if there's an absence of information, be it if there's the survey has been applied in an area and you find 0 cases, no cases, in 0 dogs or 0 cat cases. How do you approach this situation of this case? Nestor of Camila, who would like to respond to this question? Well, Dr. Nestor said, I think that we're all doing the same. If we make a survey and the survey gives 0 dogs or 0 cats, this survey is actually considered as solid information so that we can have the ratio actually of owners with pets. And we see the ratio actually between the person cat or the person dog ratio. If the 0 result is a valid result, the question is very important because we have to clarify surveyors in their capacity building seminar, they should keep this in mind. Sometimes the person, I don't have a dog, I don't have a cat. And this household is not considered. It's very important for surveyors be cognitive of this type of information. It should be also inputted. Camila.
Camila, have you already had cases in which you arrived at a household and the number of dogs and cats was 0? Did the interviewer share that? Oh, thank you for the question. I'm just going to complement what our colleague, Mr. Nestor, said. The procedure is exactly the same. So the household or the interview with 0 dogs or 0 cats, it's interesting too. It interests us as well because we can have the false sensation. So if there are no dogs and cats, the sensation is that that's not important. No, I need to know the profile of that family, that household that has no dogs or cats. And from a populational perspective, it is interesting and important. Maybe there are different kinds of absences when we are counting. So the other kinds of data that you are collecting, maybe there are other kinds of absences, and this is going to interest us as well. What we should do is the first experiment that I shared with you, that there were many households with 0 dogs and cats. And so the counting methodology and the adjustments that need to be carried out, they need to be a little more statistically robust so that we could even consider this statistical difference. Okay, so we expect this to happen, okay? But it's interesting.
Thank you very much, Camila. 0 animal count in a household doesn't mean absence of results. Yes, 0 is also a result. Emilio, Eduardo, something important has been said. And also a question has been posed to us. Eduardo and Emilio, please, if you can actually make a comment, because you are working also in the field with the people. I ask you how many members and what type of training a field group should have. You need to have a PhD. You need to have a PhD. in making assessments estimation, Emilio. No, I believe if you go to training before the survey, it's okay. You don't need to be a professional. More than anything, yes, I would say when we see the observation of actually of stray or street animals, you have to be a little more caution actually so that you can write down these observations. If we can take data by the conditions, it goes actually the condition of the dog or the cat, or estimate actually the age bracket, for example. Actually, you have younger or older pets or animals. So we have to train our surveyors that can actually catch these details. It's a minimum training that is necessary to, so those who are going to do the survey will have a clarity on what are the questions and what are the possible responses to be expected in the survey. Of course, you don't need to have a specific professional, just training. Eduardo, you would like to add questions? Is it hard? Is it easy? Nicaragua? What type of professionals or colleagues or others worked in those teams? Well, in principle, our our epidemiologists actually went, but those who held animal health or environmental health responsible. Then they had a, and also we had a training also which in one of those centers. And I mentioned the these we have a animal health model is a model that we have in Nicaragua, and we use it in other sectors. It was of ESAD or sector has an has 5,000 people actually approximately in their population. They have a doctor at least, a nurse, and also an orderly. They were trained and also they took part in the survey in estimated actually the pet population. There was also we have 340,000 surveys. Wasn't easy. Actually, also completed in 2 week time. Everything went excellently well, and these results actually were um, presented today during my talk. Any other questions? I don't know. Yes, Marco. Also, there are questions here. You have a profile the rate of increasing the population. The methodologies could facilitate this profiling of the increasing population. You have an experience. I'm asking the other colleagues, please, if they could respond to this question. If you allow me, Dr. Nestor said, the growth of this population actually made specific analyses also in the different municipalities. The increase of the population rate can be obtained based on the regular behavior of the population. I have been discussing here in Peru, saying that would be good. Each municipality could make a baseline study every 4 years so that can have the information so the advancements that have been made in these 4 years that can generate the very own indicators in terms of the advancements that you're going to make, you're going to be developing in the coming 4 years, because every 4 years actually have a new administration in office. For now, you have a specific indication for the time being, including the amount of animals that had given birth at that period of time, is survival of the amount of animals, and also, but actually have a more accurate number is still missing. Thank you very much. Can you respond? Yes, please. Thank you.
these experiences are cross-cutting, right? They are punctual studies. However, there are some experiences, international experiences, and also in the implementation of this a group of researchers from the University of São Paulo, where they consider characteristics of ecology and demographics of dogs in order to estimate how the dynamics will be in 5 years and 10 years, especially with regards to neutering programs, and they are based in reproductive rates during a life cycle of the animal, which have to do with theoretical factors, which would be expected of canine behavior. And from that, they would make an estimate. However, as Daniel mentioned, the only possibility of getting acquainted of the real dynamics of that group of individuals is if we have 2 points in time, 2 time frames.
Thank you. Veronica, I have seen here a different question. Perhaps we could ask Emilio and Eduardo about, there are two questions that I used. What's the different time frame that should be used? And we know that it's important to repeat it. And you, who are there in the country, on the field, Eduardo demonstrated that in 2017, Emilio did recent studies. Well, what's the period of time that should be used for the repetition of the studies? Eduardo, please. Well, as we used survey, the last survey had 20 years, so we were delayed. Of course, this provoked a bigger population of dogs. So we think that in order to be able to have a best estimation, we should do a minimum of every 5 years, because it has to do with the growth, with the population index. We have to assess this every 5 years in order to see how much the population grew if compared to the last survey. Very well. Emilio, what's your experience? Perhaps what Eduardo said, yes, but if for something that is more national every 5 years and locally, but nevertheless, I think that depending, of course, of the methodology or having more or less resources twice a year locally to see how it is growing, to be able to plan the vaccination campaigns. I think it is important because given our experience with the ministry, because we distribute the anti-rabies vaccination for the year, and we have to program that annually to purchase the vaccines. And I think this could be a better strategy to do that twice a year in order to be able to know how many vaccines we will need for the next year. But this could be done locally, but nationally, yes, we could do it with longer periods of time. But if we can locally also do that whenever the season changes, in order to understand the periodicity and also the birth of the cubs, because we see that in different regions, we have usually more puppies in spring and summer, so this could vary quite a lot. So this would be important for the planning of the vaccination of anti-rabies. It would be ideal to have it twice a year. Thank you very much, Emilio, Veronica. We already went over time, so I would very much like to make a small, brief round of final comments. 30 seconds for each one of you, Dr. Gutierrez, and then we'll continue with the different speakers. Thank you very much, Marco, and excellent presentations and excellent different methodologies, but here we have to rescue one thing. Those methodologies can be adapted to the area, be it urban, domestic, or street animals. And I think we have many opportunities for the countries to try to look for updated information. And it's important to see whether they're still valid, because we work in those programs. 2 years would be ideal to be able to update the data to improve the strategies and also to optimize our resources. Thank you very much, Marco. And that's it. And yes, we can do an excellent job like the one you're doing, recompiling all these experiences and putting everything in a document for it to be used by the different countries. Thank you very much. Falcon? I would like to thank this invitation. I would like to say, for example, one thing that is extremely important is the following. The results of the studies should be necessarily be reflected in the amount of vaccinations for the vaccination campaign. Because, for example, you need to discount, first of all, cubs that are not 3 months old. And another thing is the vaccination that happens on the private level. We have to identify that as well. So they also repeat the vaccination and the anti-rabies. Some of them repeat the free vaccine as well from the public sector. And there are populations that don't care about the vaccine. To think that from one day to the next, everybody will be doing the vaccination is not realistic. We have to gradually incorporate a greater population of animals for the vaccination, and this needs to be followed by an awareness campaign. Thank you very much. Thank you very much, Dr. Falcon. Doctora Camila? Eduardo first. Camila will be the last one. Eduardo, please. Thank you very much, Dr. Vigilato. Thank you very much to all of you for this opportunity of making this presentation of this experience of the survey in our country, which was very important to improve the planning of our population, trying to deal with the elimination of the rabies. And this was very important for the national campaign. And obviously, we have to adjust at least in the next years those different methodologies in order to be able to know the amount of dogs that we have in the country, obviously with all those studies that exist. Thank you very much. Thank you very much, Eduardo. Please, Dr. Faro. First of all, I would like to thank for this invitation and for having shared with all these colleagues this experiences. One thing that we should try to emphasize is the interaction between the different levels of participation, be it nationally, provincially, locally, in order to be able to progress with those experiences, because without a dialogue and without a contribution of all the participants, you cannot do that sort of experience. As we mentioned, there are municipalities that have a lot of resources, and others might have one veterinarian for all the area, or someone that will deal with zoonosis. So without the interaction in different levels, we cannot actually do this sort of experience. Thank you very much indeed, Emilio, Dr. Camila.
First of all, I'd also like to thank for the invitation and say I am available for those who wish to ask any questions and get better acquainted. And to conclude, I would like to just reinforce the fact that despite the fact that the estimates of populations are not official in most regions, it is possible to do so. And it's possible to do this with the team which we have in place, with the structure we have available, and with the technology which we have. We do have many types of technologies and many types of methods. And the important thing is to do it and not to leave this. And this is the message I would like to leave as a concluding message, and I'm available to answer any questions. Thank you. Thank you very much, Dr. Camila. Well, I would like to therefore thank once more for the presence of all of you, ladies and gentlemen, here. And I will now go to the closing ceremony of this webinar. And Dr. Vanessa Camargo is greeting all of us. And I would like to thank all the ZOONOSIS PANAFTOSA team, Dr. Valdomero, Dr. Felipe, Vanderleia, Veronica, because without them, we could not have done such a great job, and all the communication team of PANAFTOSA, Danielle, Silly, and the IT team as well, which gave us support. I also would need to thank the governments of Argentina, Nicaragua, and Mexico for having left their professionals available for us, and thanking also the Peruvian University of Carta Venecia and the University of Ponta Grossa in Brazil.
Okay, let's not forget that all this information it will be made available on YouTube in the 3 different languages. You'll have the video in Spanish, English, and Portuguese, and also it will be recorded on Facebook in our streaming. Please send us your questions because they help us a lot in the elaboration of the final document, or where all of us who are participating will revise this document, and the final document will be available for all, and also in our page of PANAFTOSA. And for everybody will have access to the information of the seminar and some suggestions for this work. And with that, I would like to close the webinar. Thank you very much for coming, and we'll see you again. Thank you very much indeed.